Hello and welcome. In this video, I'll be answering frequently asked questions about the medication Cardizem. If you find this video helpful, please consider liking and subscribing to support the channel. What is Cardizem? Cardizem contains the active ingredient Diltiazem hydrochloride, which belongs to a group of medications called calcium channel blockers. It works by relaxing the blood vessels, reducing the heart's workload, and increasing the supply of blood and oxygen to the heart. What is Cardizem used for? Cardizem is prescribed in adults for the treatment of 1. Hypertension, high blood pressure. It may be used alone or in combination with other antihypertensive medications. Lowering blood pressure helps reduce the risk of stroke and heart attack. Chronic stable angina, chest pain, used to prevent chest pain caused by reduced blood flow to the heart, especially during physical activity or stress. Angina due to coronary artery spasm, Prinzmetal's angina, effective in treating chest pain caused by spasms in the coronary arteries. How to use Cardizem? Cardizem is usually available as extended-release tablets or film-coated tablets. Your doctor will determine the right dose based on your condition and how you respond to the treatment. Always follow your doctor's instructions exactly. Do not change your dose on your own. Swallow the tablet whole with a full glass of water. Do not crush, chew, or split the tablets. Take it with or without food, but try to take it at the same time each day for consistent blood levels. Typical daily dosage usually ranges from 180 mg to 360 mg per day, depending on the condition being treated. Your doctor may recommend splitting the dose, e.g. morning and evening. If you forget a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one. Do not take a double dose to make up for a missed dose. It may take a few days or weeks to notice the full benefits of the medication, especially for blood pressure control. Be consistent. Precautions. While using Cardizem, use cautiously if you have low blood pressure, hypotension. Should be used under close medical supervision if you have heart failure, AV block, or sinus node dysfunction. Dose adjustment may be necessary in patients with liver or kidney problems. Consult your doctor before using during pregnancy or breastfeeding. May cause dizziness or lightheadedness. Be cautious when driving or operating machinery. Alcohol can increase the blood pressure lowering effect of Cardizem. Possible side effects of Cardizem. Common side effects: headache, dizziness or lightheadedness, fatigue, swelling of ankles or feet, edema, nausea or constipation. Less common or serious effects: slow heart rate, bradycardia, skin rash or itching, elevated liver enzymes, allergic reactions, rare but may involve swelling, rash, or difficulty breathing. If you experience severe or persistent side effects, contact your doctor promptly. If this video helped you, don't forget to like, comment, and subscribe for more content like this.